day 1, day 35, day 45. It's not easy. It's a tough thing, but the support is there from your doctors, to the nurses, to the supportive care group upstairs. These people are awesome. I wouldn't be here without them.
Thought through, what does cancer look like in 2015? Where do we need to get to? What are those goals? And we kind of divided it out into what we eventually became 8 transformational initiatives that would not just advance the program, but truly transform it. You know, it was just a lot of collaborative work by a lot of experts in the field of cancer. We also costed it out and realized at the time that we were creating it that it was an expensive plan, and you know, around the 32 million range is what we estimated we would need to spend if we wanted to realize all of our goals in the plan.
In the 40s, about 25% of cancer patients survived past 5 years. Today that number has increased to over 60% survival rates. So that's a tremendous increase in survival rates, and a large part of that is due to research and the contributions that research has made to understanding cancer, diagnosing cancer, detecting cancer, and treating cancer.
You can imagine that if you're recently been diagnosed with cancer, really the last thing you want to do is to travel away from your home community, away from your family. Even if it is to get wonderful care, if we can give you the same kind of care here, it's much better for the patients in general. So exceptional cancer care means exceptional diagnosis, exceptional treatment, and exceptional research, which we can all have available here in Thunder Bay.
The cancer centers, it's so warm and welcoming. The people, the administrative staff, the oncology nurses, the chemotherapy nurses. I mean, my experience getting chemotherapy and sitting there for hours at a time was actually not as bad as I thought it would be. I was distracted from it a little bit, and the nurses were outstanding. I actually miss them. I do.
The care here is second to none. We know that. Everybody in the community knows that. I made phone calls to other centers. I had to check. And you know what I was told by these other centers, big centers? The care here in Thunder Bay is as good as anywhere in the world. They made me feel good that I didn't have to go anywhere else to get taken care of. And that was peace of mind for me and for my family. And everybody knew it. We know we got a world-class facility here, and the physicians and the nurses and the whole staff, everybody here, you don't have to go anywhere else. It's amazing.
Development of the Regional Cancer Center here in Thunder Bay. What we have now is the best team, the best equipment, the best treatment options, all close to home. And the notion of being able to have this kind of patient care close to home just makes it easier on everybody. We're able to cluster the resources, financial resources and medical care resources, and being able to serve the region as a whole. It's just worked out wonderfully for so many people.
We believe that all of the people living in Northwestern Ontario should have access to modern, first-rate cancer diagnosis and management of disease, and we work very hard to deliver that care.
In order to maintain and even improve the quality of care here, at our hospital, I mean, we need to be to par with all the equipment that is needed, right, to standard, so we don't have to travel to Toronto and down south and other cities and centers to get the best care. I mean, equipment costs so much money. I think it's staggering actually how much it costs. And we need funds, we need people to donate so that we can enjoy the same level of care here in Northwestern Ontario as they do in other centers. It's just plain and simple as that.
Funding from local sources to fund research that's important to the local area like Northwestern Ontario, that can really help the scientists tackle issues that are important for Northwestern Ontario and impact patient care in the long run.
People need to think that way. The fact that it's local, it's the best equipment that we can get, and that we are providing the best care possible for Northwestern Ontario.
Foundation has always been an active partner along with the Regional Cancer Program, and the Foundation realizes there's a community portion of those funds to really make it happen. And the community has always been very supportive of the cancer program, and I think it's because of the demonstrated results. So the Foundation is fully 100% behind helping the community raise these funds to make this big vision a reality.
More people are living with cancer than dying from it, so it just goes to show that there's improvements made all the time and that there is more hope. I mean, when I first got diagnosed, I was so mortified, I was so scared. But then as I got to be educated with what our center can do here and how technology has changed, I mean, it does make me extremely hopeful. I mean, I feel so much better and I feel so good about it. And I feel really like I have a positive future because of our center here in Thunder Bay.
To ensure exceptional cancer care for the people of Northwestern Ontario, we need your investment today. Together, we can make hope possible.